Hello, my name is Michael Harbut. I'm a professor of internal medicine at Detroit's Wayne State University, and I'm a specialist in occupational and environmental diseases at Southfield, Michigan's Providence St. John's Hospital. The purpose of this brief videotape is to give you some idea of what sorts of things you can expect when you go for an evaluation for an asbestos-related disease at a facility which is practicing at 21st century medicine levels. The first thing that you should look for is a facility which has a board-certified specialist in pulmonary medicine and/or occupational and environmental medicine. There are other possibilities in terms of specialists, but these are sort of the mainstays of the evaluation for asbestos-related disease. Among the things that might compel you to seek help for asbestos-related disease are shortness of breath at climbing one flight of stairs, pain in the chest on breathing, pain in the back on breathing, coughing, wheezing, or the production of sputum, which could be blood-tinged. If there's anything that you notice, however, in anything related to your breathing or gastrointestinal tract or any other unexplained medical phenomenon, you should see your family doctor or primary care physician in any case. Among the first things that are done when you go for an evaluation for an asbestos-related disease is a history and physical examination. You should have a very thorough history taken, and you should give a very thorough history as well, and it should include all sources of toxic exposures that may have occurred in your work or in your family life. For example, a person who works in asbestos often brings asbestos home on his or her clothing. If you happen to be one of those people, you should have your family be aware that they may have breathed in asbestos fibers as well. The physical examination at a minimum should include the head, the chest, and the abdomen. The doctor will listen to your lungs quite carefully for the sounds of rales or crackles in the lung, or wheezes, or other indicators of lung disease that could be associated with asbestos. After the history and physical examination is performed, you should be considering the performance of a complete pulmonary function test, or at least the physician who's taking care of you should offer for your consideration a complete pulmonary function test. Now, many people think that a complete pulmonary function test is when you go to the doctor's office and blow in a tube 3 times. That's only part of the test. The rest of the test involves sitting in a plastic box or similar device in order to measure lung volumes and the ability of the air to cross over the lung into your bloodstream. Now, among the most important things for diagnosing asbestos-related disease is the radiographic study. Before now, or in the old days, if you will, in the last century, we used to do just a chest x-ray to look for asbestos-related disease. That's really not good enough anymore. We know that if you have any symptoms which might be related to asbestos-related disease, you should probably have a CAT scan. That's a computerized tomographic examination of the chest. Now, there are 2 different kinds that are being done most frequently right now on people with asbestos exposure. The first is called a low-resolution CT. This is a very quick, low-radiation CAT scan which looks for nodules in the lung but doesn't give you all the detail that you might like to have for diagnosing things other than cancers. Now, it was recently recommended by a number of certifying professional organizations that a low-dose CAT scan be performed in all smokers with asbestos exposure over the age of 55. Now, that doesn't exclude you from the possibility of having a CAT scan done, but instead this is a recommendation for people who have essentially no symptoms and only have the exposure to cigarettes and asbestos. Now, there is further work in the field which shows that asbestos exposure confers probably the same amount of risk as smoking does on persons with exposure. In these cases, you may wish to have a low-resolution CT done purely as a mechanism to screen for the presence of lung cancer. Among the things that happen with asbestos exposure is that the asbestos fibers are breathed in to the lung and often swept up to the back of the throat and swallowed. This leads to an increase in the incidence of colon cancers. This is a very common cancer in the population in any case, being the second leading cause of death among men and women in the United States. But it's very important that people with asbestos exposure know and understand that their risk of getting colon cancer is about doubled because of the asbestos exposure. Now, in order to find out if you have colon cancer early, The best test available in most cases for us in the United States at this time is the colonoscopy. You need to ask your doctor about it in order to screen you for the possibility of the development of early colon cancer. Among the things that you may wish to discuss with your healthcare provider in terms of preventing other illnesses related to asbestos exposure are the administration of a pneumonia vaccination. Pneumonia is one of the leading causes of death among people with asbestos exposure, and a pneumonia vaccination can prevent an enormous incidence of this disease process. You should also get a flu shot every year unless there's some contraindication to it. Please ask your healthcare provider about this. Now, one thing that we'll ask you to do is to take a look at the other spots on this website that make reference to the evaluation for asbestos-related disease. You'll note that there is a request that is made to your doctor to notify Dr. Andrew Todd at Mount Sinai Hospital in New York City if there is any asbestos-related disease biopsy taken. This is a sample of tissue which can't be discerned adequately by CAT scan or direct visualization through using fiber optics in order to evaluate what are called lesions in the lung. In other words, if you have a lump in your chest or you have a nodule on a CAT scan and the doctor ends up doing a biopsy, we'd ask that you send some of that tissue or ask your doctor to send some of that tissue to Mount Sinai Hospital in New York City, where the Insulators Union has a large repository of material, meaning biopsy material, to help us better understand asbestos-related diseases. Another thing that's important for you to know is that an asbestos-related disease diagnosis is not a death sentence. Most cases of asbestos-related disease cause scarring in the lungs and evolve over many years. In the hands of an appropriate provider or a doctor who's been adequately trained in the field, often medicines can be given which make breathing easier and better. Furthermore, just because you have an asbestos-related disease or a diagnosis of an asbestos-related disease does not mean that you're going to definitely get a cancer. What we worry about is the development of a cancer, and that's why we do the CAT scans early and regularly to detect a possible cancer as soon as it may appear. This is actually life-saving, so you need to consider this when you're contemplating the possibility that you may have an asbestos-related disease. I hope this brief introduction to what to look for at an asbestos-related evaluation is helpful. Please contact us at the website addresses noted elsewhere on this page and let us know if you have any questions or if there's anything we can do to help. One final thought. Many times patients will tell me that they know they can't have asbestos-related disease because they went to an asbestos screening organized by a lawyer. You need to know that legal screenings for asbestos-related disease are often totally unrelated to what's actually going on to a person with breathing trouble. So just because you might have been told you have an asbestos-related disease at a legal sponsored screening or that you don't have one, you can't depend on that as being the health reality for you. So please contact your healthcare provider or primary care physician and ask if he or she can help you arrange for an asbestos evaluation. Thanks for taking the time to listen.